Hello and welcome to our panel discussion here with healthcare professionals from Huntington Hospital. I'm Councilman Mark Cuthbertson, and I am delighted to be on this call with Dr. Nick Fitterman, who's the Executive Director of Huntington Hospital, Dr. Rita Huertas, who's the Chair of Emergency Medicine, Christine Zingali, who is the Director of Cardiology and Critical Care. And Christine always sets a great example because I see her walking around my neighborhood, our neighborhood, all the time. So when it comes to cardiology and exercise, she's great. She practices what she preaches, I'm sure, every day. Cecil Joy, who is a respiratory therapist, and Sandra Mora, who is an environmental services specialist. And I'm here and delighted to be here with these healthcare professionals. The COVID-19 pandemic, of course, wreaked havoc on our healthcare systems. Huntington Hospital was unfortunately in the middle of that. But I first want to begin by just saying a tremendous thank you on behalf of a very grateful town. I know all over town we've seen symbols and expressions of gratitude, but we can't really say it enough how much we want to thank all our healthcare professionals, because we really were living in a time a few months ago, and we're still in the throes of this. I don't want to misrepresent, but things were changing so fast on a minute-to-minute basis during this crisis, and we wanted to talk to you about your experience and talk about how your employees cope with this and how this all came about, this huge undertaking of going from, normal operations at Huntington Hospital, which I think anyone who's been there know that it is a well-operated hospital, but it's hectic. On a normal day, it's hectic there. So to gear up and do what you had to do when it came to COVID patients, really we had record numbers, especially in the beginning, and facing all of those things, including really a scarcity of PPE equipment and what that caused to patients and employees. So we wanted to just have maybe an hour-long panel discussion, and maybe I'll kick it off by throwing it to Dr. Fitterman and ask him how it was to go from a normally hectic operation at Huntington Hospital to a pandemic almost overnight.
Thanks, Mark. It was this pandemic was as challenging as it was humbling. As you know, New York State was epicenter in the U.S., and Huntington was the epicenter in Suffolk County for the first several weeks of this pandemic. And we had to learn as we were going. We were fortunate to be part of the Northwell Health System. So PPE was never an issue for us, thank goodness, unlike some other hospitals and healthcare systems. Our staff always had enough PPE. That was not an issue. Normal operations, as you said, a hospital can be a hectic place to work. And we were inundated with these severely ill patients. And it was remarkable. Our staff stepped up. Everyone who works here did a phenomenal job. Mark, if I walked you through this hospital at the peak of the pandemic, which was April 6th and April 7th for us, you would think that it was standard operating procedure. There was no chaos. There was no craziness. We developed policies and procedures on the fly. We executed them beautifully. And the only difference you would have noted is that everyone was wearing PPE. But we had quadrupled our intensive care unit beds. We increased the total capacity of the hospital by more than 50%. We have surge plans. We go through a process of developing emergency action plans and surge plans. We have tabletop exercises and even live exercises throughout the year. So we started planning for this back in January. And even though we had to change many things on the fly as we learned more and more about this vicious virus, we handled it. I'm happy to say that we were able to provide the needs, meet the needs of our community. And I gotta say, I don't know if this is going to come up later, but I got to blurt it out now. We and the collective, we here at the hospital, thank the community because we felt the love, we felt the support, the signage, the meals, the banging of the pots and clapping every night at 7 p.m. a change of shift. Every caregiver in this hospital who was under tremendous stress and duress, felt the love and felt the support of the community. So thank you for that.
That's great. Before I throw out a question to the whole panel, was being a part of the Northwell network, did that have an impact on how quickly you could gear up and how you went about this, or are you, as a standalone, you're doing that? How does that work?
It was absolutely an asset to be part of the Northwell network. Their supply chain and their planning that began months in advance never left any of our staff in danger of not having enough PPE. They were able to shuffle equipment, for example, ventilators. We at Huntington here, at one point we had almost 10 times the normal number of people we have on ventilators, on vents here in the hospital. Being part of Northwell, they were able to take ventilators from other hospitals that were not as severely impacted by COVID and deliver them to us. So we never had a shortage of ventilators. We had excess ventilators, again, to meet the needs of our community. In addition, Northwell has been at the forefront of researching COVID and developing treatment protocols. So we had the advantage of having access to those literally real time. As the subject matter experts came up with what the newest or best way to approach and treat a COVID patient became available, we had it in our hands within minutes, and we were able to change treatment protocols in less than a day. We couldn't have done all that on our own.
Wow. A question for the panel, and I think we'll go around the horn, maybe start with Joy. How would you describe what it was like coming to work during the height of the crisis?
It was very interesting because when you're driving into work, it's very quiet out on the road. But when you come into the hospital, it is, like Dr. Fitterman said, hectic, but it is a systematic hectic. Everybody knew what they were supposed to do. Everybody was working as a team, respiratory therapists, nurses, doctors, EVS. Everybody knew what their role was, and everyone was able to perform well as a team. We knew that what we had to do was take care of patients who were critically ill with a disease that we didn't really know much about at that time. But we did our best, because if we didn't do it, who would take care of these ill patients?
So, Joy, just so people know, you're a respiratory therapist. What would that entail in terms of your interaction with patients, specifically on a day-to-day basis during that time?
Well, we are pretty much the definition of front of the line, because we take care of ventilators and we know the A to Z's of ventilators. So our primary goal is to maintain the patient's airway. So any patient or any COVID patient who was intubated, we would be there to take care of them, manage the vents, make sure that their blood work, their blood gases and everything correlated properly with their oxygenation and their carbon dioxide levels. So it was very critical, and it was very hard because we had so many patients everywhere, and it was a lot went into teamwork for us to work it really well.
Sandra, I'll pose the same question to you. Maybe if you could unmute. What was your day-to-day like during the height of the crisis?
Okay, now you can hear me?
Yes.
Okay. Like same, everybody, every day come with a good positive, mentality that we're going to give it 100%, make sure to follow policies and procedures and make sure that we did a good clean to protect the next patients who's coming and use, the rooms and basically we use on top of everybody and try to support them and, to make them feel that they're not alone. So we're a team, and we all of us, we're here for patients' care.
Great. Dr. Fitterman, what was your day-to-day like during the height of the crisis?
Well, every day was in the hospital, all day, every day. I think it was 57 straight days that I was here. Wow. I know this will sound a little bit crazy, Mark, but it was exciting in the sense that we live for this as healthcare workers. We live to help protect the sick, the ill, our community. And It was a career-defining event. And that has to be balanced against the pain, the suffering that we saw in our patients, in their families, the grief that our staff had to experience being in the throes of the pandemic and seeing such suffering and illness. But coming to work every day, it never felt like a challenge. It felt like a calling. This is what we trained for.
That's great. Christine, if I could ask you as well, what changed about your day-to-day and what was it like during this time?
Okay, so basically all of my units became critical care units in a matter of days. It was like nothing we'd ever seen before. Patients on really high concentrations of oxygen, codes left and right, multiple at one time. Patients so sick that in all of I've been a nurse for a long time. I've never seen anything like that as far as the intubated patients, the amount of drips they were on. The teamwork that took place was unbelievable between Sandra's team and respiratory and pharmacy and the intensivists. The teamwork was what made everything possible. As far as what I would want other people to know is, even talking to some of my family and, friends, they would say, oh, well, it's older people who have pre-existing conditions. And that was not necessarily true. There were many young people, people who did not have pre-existing conditions, and it was not a discriminating kind of disease, like Dr. Fitterman said. So that's what I would want other people to know and to really take this seriously, because what we saw was really unprecedented.
Dr. Huertas, if you could unmute and tell us what was your day-to-day like in the height of the crisis?
So, like everyone else, you're coming in on a daily basis. Unlike Nick, I did not work 57 straight days. I was here for 21 days and then another 23 days. I did skip a couple of days in between. But you're sitting there trying to figure out how to best service your community, the patients, and keep your staff morale where it needs to be and their safety where it needs to be. So again, you come up with new and innovative ways to accomplish tasks that are different than what you would normally have to do. And so we were able to do that and able to treat the patients that we needed to treat. The ones that were sick were taken care of. The ones that weren't quite as sick, that were worried, were also taken care of. And we accomplished that as a team. We have a great team here, great leadership. The system has great leadership. And overall, I think we did a fantastic job.
That's great. Maybe a question, I'll go back to Joy. I think people have an idea. They've read articles, they've seen news accounts and videos, but what do you think is something that the average person would not realize that was going on day to day in the hospital that may have not, made it out into the public realm?
Very intense. You just saw, like Dr. Fitterman said, there were a lot of patients. It was exciting, but it was not just exciting for us. It was a little scary for respiratory therapists because we started seeing so many patients being intubated on a daily basis. At one point, I believe we had over 55 vents running on the same day. And that is a lot of vents, and that's a lot of critically ill patients. And when I went back home, my family would ask me, how was your day? And I would be shocked, and I would not be able to tell them exactly how intense and how horrific some days could be. But we were able to do the best that we could do for our patients, and we tried our hardest. So I just want to say that.
Great.
If I may jump in, one of the messages to get out to the public that may not have really been transmitted is, and that's what I think you just heard, is the severity of the disease. If we could have walked everybody through this hospital to see what it was doing to patients, there would be no question that everyone would be wearing a mask, everyone would be socially distancing. This would not become a political football. This virus did horrible things, not just attacking the lungs, requiring people to be on ventilators, but we saw it cause strokes. We saw it cause kidney failure, heart attacks. It is ferocious. And the public needs to know that. And if everyone's aware of it, we won't all be so glib about it, even though it does get tiring to wear masks and obey social distancing.
Well, I'm glad you say it, because I wish you could broadcast those images and send them to the governor of the state of Georgia, because I know it'll sound political, but I'm okay with it, because it's people's lives, and that really should be the bottom line. And the notion that in that state they now have upended local mandates to wear a mask and are saying it's voluntary, to me it's just such an absurdity. And I'm so glad you share that, because people do. I think we're getting back to our old habits. We're not back to normal, and people really need to remain steadfast. So I'm really glad you said that. Sandra, if you could tell us maybe what are some aspects of the job that people might not have seen behind the scenes that they wouldn't know about from news accounts?
We terminal clean every single day after we have a discharge patients, neogen test to make sure that the room is clean. And that's basically, that's the key, to make sure that the room is disinfecting for the next patients. But I think the stress that everybody bring into the work, it was bad.
If I could ask Dr. Huertas, maybe if you could tell us something that, from your perspective, that the average person might not have seen in news or other accounts.
I guess we all know how severe the disease was, and everyone here already described the effects. I guess the biggest surprise to me was how quickly it spread in a household. How once it grabbed foothold in that household, the members all got sick. So unlike the flu, where you may get the flu and you live in the same house, there may be 4 or 5 people in that house, maybe 2 other people might get sick. Here, if one person got COVID and they were in close contact in the same house, it seemed like everyone in the household developed COVID. And so we got large numbers from certain communities and certain households, and these people were really sick, and they got sick quickly.
You know what? I'm going to go off script, and it's not on my script, but it's something that stayed with me, and maybe you could share that experience. What was it like treating people who were in such an extreme situation in circumstances where they couldn't have visitors? What were the challenges of that? Maybe I'll start with Joy.
It was very hard, because I think part of healing is you need to have care, you need to have support. And, if you have your family or visitors around you, that would be great. But here, we didn't allow for visitors for the safety of our patients and for the safety of our employees. But it was very hard. We had a lot of staff actually going and talking to these patients, spending more time with them, trying to console them, being there for them as much as we could be before we had to move on to the next patient. But I did feel bad. We did, as a department, we did speak about how a lot of people were there just by themselves in the rooms alone without any company. But Northwell was able to do virtual visits. So people were able to do phone call and iPhone and FaceTime visits. So that was good. It wasn't a physical visit, but at least there was something to do,
Great.
And Dr. Fitterman, what was your perspective on that?
Yeah, it really was tough. Everyone felt the tragedy of seeing people critically ill and not being able to have their loved ones at the bedside. But I want to be clear about a few things. One, this was an executive order that came from the governor about restricting visitations, and I 100% agree with it. But the reason was not to protect the public from catching COVID in the hospital. The hospital is a safe place. The seropositivity or the conversion rates or the rate of people getting COVID in the hospital, even though we were up to it in our eyeballs, is less than in the community. The reason for the restriction was we didn't want the public bringing COVID into the hospital and exposing non-COVID patients and exposing our staff, who was so critical. And that's an important message, because somehow that's gotten lost and people are afraid to come to the hospital for illnesses which are severe. We've had people delay treatments for heart attacks, for strokes, for surgery, and they've suffered with worse outcomes as a result. But back to your original question, what was it like? It was heartbreaking at times. It really was. We had staff. We created what we call a virtual visit team. And the team, literally, we redeployed people that weren't doing their usual job. And they went around with iPads and connected patients to their family members. And sometimes they were in the room holding an iPad, dialing in the family to allow a patient to say their last goodbye before they were intubated, or to a last salutation before they possibly passed or went for a test. And it was devastating to the staff to see that. We've been doing quite a lot of work here to help our staff grieve and to help them heal as a result of dealing with things just like that, the virtual visitations.
Yeah, I mean, I guess really it's a form of collective and individual PTSD that your employees must be going through to have lived through that. It is really unimaginable. I think we on the outside we can read stories and we can hear things, but I just don't think without being there, you have that perspective. Dr. Huertas, how did the challenge of the lack of visitors impact you and your day-to-day when it came to this?
There were some positives that were associated with this. It allowed us more time to take care of our patients. And the staff was able to accomplish more care for the individual patients. The negatives were the same. I mean, it's heartbreaking when someone is severely ill and they're alone. And often we would step into the room and hold a hand or just talk to some patients to let them know they weren't okay, that they weren't alone, and that everything was going to be okay, even when it wasn't going to be okay. So it was difficult for the staff. To this day, it's actually something we still discuss, and people had a hard time going through it at the time.
Christine, I'll pose the same question. What was your perspective on operating in this unique environment when it came to a lack of visitors and family?
The virtual visits were really helpful and a comfort to the staff and the patients. The other thing was that some of our community physicians came in and they took the role on of calling families and updating them multiple times a day, which was so comforting to them. As far as the nursing perspective, our nursing leaders would call multiple times to families during the day, would accept calls, updating these people who are at home, just waiting for any word of how their family was doing. We had some of our patients were here for 50, 60 days. So multiple calls, and they formed relationships with the family members. So even though they didn't meet them in person, they were able to connect with them.
When you say community physician, so maybe the local orthopedist came and pitched in and helped out with that? Really? That's terrific, because I think that, that's an unsung part of this. I certainly did not know. Many others may know that, but the notion that docs who weren't necessarily a part of the emergency care were pitching in is just terrific. Sandra, let me ask you, any perspectives on the lack of visitation and how that impacted what you did day to day?
We just had the opportunity to have a conversation with patients, what people are cleaning and do on a regular basis. So they had the opportunity to support them, help them. So we do more patient safety rounding and make sure they were okay, they're receiving what they need. And my personal experience, so I found few patients who made them feel really support, especially people that don't speak English, and yet they found somebody to speak the same language. They feel really good. Even one of the patients was crying, and I said, "Thank you. You made me feel really good. I appreciate it. You guys are the best." And that's what we hear. And that's a great satisfaction for, I think, everybody who they can contribute a little bit.
Great. We obviously that's a very difficult and a part of a difficult problem. Is to be in the hospital without visitor. I want to go to a more hopeful aspect of what you all were involved with, and this piece I thought was amazing. I followed on social media how the hospital was indicating how many people were being discharged, because it was easy to just fixate on the positives and a death toll, but it was great to see the post where someone was being discharged, and the celebration that went along with that. And you all, I know, and other places played Here Comes the Sun each time somebody was discharged in the hospital. Tell me, who organized that and what was that like? I'll start with Dr. Fitterman, maybe.
Thanks, Mark. Yeah, that was actually a brilliant idea that came from our nursing leadership. They asked us to find a way to celebrate the victories, the discharges, and we kicked around a few songs that I won't share with you, but we vetoed all of them and came up with "Here Comes the Sun." And I can't prove this, but I am proud to say we were the first to do it, because I know there are a lot of other hospitals that started to do this. And it made a difference. People started lining the hallways and clapping patients out as they left. Every discharge became a celebration. We then extended that to people as they got extubated. When someone came off a ventilator, we would play "Here Comes the Sun" as well.
Joy, I mean, leading right into that, what was your perspective on people being extubated and being discharged, and your part in that process?
Well, we were there. We're the people who are there to take the tube out of the patient's airway. So we're the people who perform the extubation. And it was, in the beginning, a little nerve-wracking because we weren't sure if the patient would do really well off the ventilator or not. But once a couple of hours passed, a day passed, and as we saw that their strength returned, that they were doing good, their numbers improved, it really gave us a lot of confidence that people would be able to be successfully extubated, even if it's in the long course. So that was definitely a good, heartwarming moment for all of us here.
But interesting to go from extubation to, a time of concern and trepidation, and then after that, when there was a discharge, so there was a whole it wasn't an immediate gratification,
no.
Right?
Nobody got extubated and got discharged right away. It was a slow process, and it was very good to see at the end when they would leave the building how they looked, how they felt. It was very nice to see that.
Christine, same question. I mean, what was you and your staff's role, and how what was that when it came to discharge and this really collective effort to let it be known, not just in the hospital but outside the hospital?
It was such a gratifying experience when somebody would be discharged. Obviously, we'd be preparing and leading up to it, and working with physical therapy and the other team members to get them strong enough to be discharged. But some of the patients that we had for an extended period of time, it was just such a heartwarming experience to see the people that would line up, clap. Family members would be outside clapping, waiting for them. And many of the patients were back in touch with us after they returned home. So it was a very gratifying experience for us.
Great. And same question to Dr. Huertas. What was you and your staff, your role, and what are some perspectives that you can share on that?
Well, our perspective is slightly different, since we were the ones who were bringing them into the hospital and not really letting them out of the hospital. We did, on occasion, when available, go out to the lobby and clap along with everyone else, because you want to see that perspective, that a lot of people got better, a lot of people made it through this disease and actually went home, and that was important for the staff to see as well.
And Sandra, you are there at the tail end. Discharge happens, and then you've got a job to do, right? Is that the perspective that your department brings? Or
yeah,
no?
we have a lot of job to be done. Like starting with a terminal, clean the entire unit, imaging tests, every single room. Showers, nurse stations, pantry, painting if we need it. Strip and wax all floors, all unit, like make it like a new unit. For the next patients coming. So
they got discharged, and the work. I mean, you were working all the time, but the some real hard work began there.
Yes.
Maybe I'll throw, and I'm going to open it up to all of you to talk about what you'd like in just a second. But I want to ask this last: what's from your perspective, a part of the new normal at Huntington Hospital now in the aftermath of COVID? Maybe I'll start with Joy.
Is wearing masks when you're at work. We started doing that right at the beginning, but we have continued with that policy even now. And we also wear protective eyewear while treating patients. So those two are the main new normals that we have. But in respect to specifically respiratory department, we have ventilators, we have BiPAPs, we have high flow oxygen, we have oxygen helmets, all these different modes of oxygenation ready for patients to use. And we do not do any aerosolization of any medications. That way we don't spread anything in the air.
Let me stop you for, I did not understand. What does that mean when you say, was it aerosolization with?
Aerosolization, so basically nebulizers. Are you familiar with nebulizers?
Yes.
It's basically, yes. So when you have a nebulizer, you're aerosolizing the medication into the air, which then goes into the patient's airway. We don't do that anymore because there's a potential that we could be spreading, or there's a chance something could be going into the environment or atmosphere. So instead of that, we do give patients MDIs, the little inhalers, and they do their treatments that way.
Understood. Dr. Fitterman, what's the new normal like for you as the executive director at Huntington Hospital?
The new normal is really a heightened alertness and awareness that COVID-19 is among us, that there's no cure and that there's no vaccine. So we obey universal masking on both patients and all staff. We have thermal scanners. When everyone walks through the halls into the halls of the hospital, they are scanned for temperature. They are asked about symptoms. All staff attest to the fact that they have no symptoms that could be consistent with COVID each day. We ask that of all visitors. And it's important to know we test every single patient for COVID, whether they come in with non-COVID symptoms or COVID symptoms. Every person who gets admitted to the hospital now gets tested for COVID. We want to assure that we never have a non-COVID patient cross paths with a COVID patient. So we are really hyper vigilant about rooting out any possible COVID symptoms, COVID disease, keeping those patients separated on separate units. So patients in our community, and I mentioned this earlier, could feel safe. If they come in here without COVID because they need surgery or they're having chest pain or symptoms of a stroke, we can assure them that they're never going to cross paths with anyone who has COVID.
You know what, I want to just dwell for a second on testing, because the height of this, rightfully, the tests were scarce, and I think the healthcare system was told to be very stingy when it came to testing, and really there was a lot of probing about symptoms. Did you really have symptoms? Do you really need to test? What was that like in the beginning, and what were the sort of general idea of the standards, and what's the standard now?
Yeah, so at the beginning it was very frustrating. Supply chain issues within our country limited our availability to test, so we had to be super restrictive. And even then, the tests were limited. It took a long time to get the results back. The reality of it now is we have a lot of testing. Again, fortunate to be part of the Northwell system, where we can churn out several thousand of these tests per day. By the end of this month, we'll have our own machine in the hospital that can churn out several hundred every day in a matter of 2 hours. And now we will test anybody and everybody. What we also learned from the beginning of this pandemic, something we didn't know on March 9th, was that you can have COVID and be contagious for about 2 days before symptoms develop. That's why we test everybody who walks through the doors of the hospital now.
That's great. Christine, over to you. What is the new normal for you and your department now?
As everyone else said, wearing masks, of course, the temperature scanning as we walk in. Our patients who come in for procedures, we test them all. If a patient does need a procedure and is COVID positive, there's a totally different pathway that we have them take so they don't cross paths with someone who's non-COVID. So it's very different. You know, we don't have meetings like we used to have. Everything is is, on a Teams meeting, not a lot of contact face-to-face with our colleagues. We try to maintain our social distancing as well.
Okay. And Joy, something I skipped over and I was curious about was the whole process of proning patients, and how important of your day-to-day work was that, and what was entailed in that, and maybe explain, because I know I won't do a good enough job of what proning is and why it's important.
Well, we wanted to prone patients so that we give their lungs a chance to expand and get more air in, and there would be more movement in it. In fact, Dr.
What
Fitterman
exactly,
might be
let me
able
interrupt you. What exactly is proning in layman's terms?
Proning is when you are laying on your belly, pretty much. One of the doctors called it tummy time. So you're just laying on your belly, you're exposing your back so that your lungs have an opportunity to not be, it would be against gravity. So now it would be able to inflate and get more air in it. Dr. Fitterman would be able to explain more about that, because we did have a proning team that did great work throughout the departments in Huntington Hospital, all the different critical care units.
Dr. Fitterman, from your perspective on proning, its importance in the process.
Yeah, so proning, as you just heard, was we flip the patient from their back onto their stomach, and it helps recruit other areas of the lung that may not have been being utilized to help maximize getting oxygen to the body. And what we did, and I can't take credit for this, but one of the brilliant ideas was to develop a prone team. There was no surgery going on during this pandemic other than extremely emergent surgery. But the people who work, the technicians, nurses who work in our operating rooms are experts at proning patients, because they'll have to turn patients in the operating room for various procedures, for example, spine surgery, or patient may have to be prone. So we created a prone team because it could be very labor intensive. You can imagine a patient who has IVs in their arms, catheters in their neck, catheters in their bladder, and a tube going down their throat that is critically important to their life. That to turn that patient over is not as simple as flipping them over. It literally takes 5 to 6 staff members to prone one patient. So we created a prone team that would go to all of our ICU beds and assist nurses with flipping our patients. And it was wildly successful, and we saw people's oxygen status improve literally within minutes when we proned them. It got to the point where patients that were suffering with low oxygen but did not yet quite need to be put on the machine on a ventilator, we would ask them to prone themselves, to roll over in bed, and we would see improvement. That's
great. We were sort of coming to the end, and I wanted to pose this to all of you. I'll go around. What would be something you want to share, or a message for the community that you would like to share as a part of this process and what you've seen? I'll start with Christine.
I would like to share that it's safe to come into the hospital. If someone's having chest pain or stroke symptoms, please come to the hospital. We can make sure that you're safe here. When we did open back up to doing some of our procedures, we had patients who came in and said they had chest pain last month but didn't want to go to the hospital. So I'd want everyone to know that it is safe here, and please come and don't sit at home with dangerous symptoms.
Dr. Huertas, how about you? Final word for the community, or any other perspective that you have on the process and what things are going to be like going forward?
I guess the message I want to get out there is that we were here before and will be here after as well, that we're ready to take care of any condition that may arise, whether it be stroke or heart attack or any injury at all. The staff is ready, the hospital is ready, and we can take care of anything.
Great. Sandra, over to you. What would you like to say to the community, and what's your final perspective?
I just can say that this place is safe and clean, and they don't have to be worried. They can come in. We're a good, we have a good team, and they don't have to be afraid. They're in a good hands.
Terrific. Joy, how about you? Final thoughts, words for the community?
Yes, first of all, I just want to say thank you to the community. They have been great in giving us so much support and so much tokens of encouragement and appreciation. We still have a lot of things that they gave us out here as great reminders of their kindness. So thank you to the town of Huntington and the local community here. And also, I would like everyone to just say, please wear their masks and be socially distant, but not to be afraid to come to the hospital for any care that they need. Because like Sandra said, we are very clean, we are very professional. The employees are taking every precaution that we can take, and they're going to be in good hands.
You know, it's funny you say, I obviously people were worried about gaining the quarantine 15 at home, being sedentary, couldn't go to gym. I worried about our healthcare workers, to be honest with you, because I saw what generosity there was when it came to food and these wonderful food deliveries. And I think, by the way, a terrific thing that healthcare workers were doing was saying thank you and showing what the food was that was there. So it was a reciprocal thing. I know they were busy, but they took the time to take a picture and snap it and put it on social media and keep the good feelings going. But I did worry. I don't know. I would have had a hard time going to work there, working those type of hours and not exercising. But let me finish with Dr. Fitterman, final perspectives and a message for the community.
So Joy stole my thunder. It was to please wear your masks. This is a ferocious virus. And also to thank the community. The love and the support was immense, and it was truly heartfelt by everybody here. So thank you, everyone, and please be safe.
All right. Well, I want to thank all of you, first and foremost, for the effort of the past 3+ months and everything you do, and for the calling in your life, because this is not, you go to the heart of danger, and I think that's what people appreciated, is that it's safe because of the precautions that you take, but it's still, there's a risk there. So thank you from our community for not just the past 3.5 months, but for the vocation that you have in healthcare. And a lot of great takeaways today, but I think some of the ones that really stick with me that are, please wear a mask. Please know how vicious and ugly this disease can be, and let's prevent it. And, wearing that mask, you'll never know the life you save, but you can be confident that you probably did if you do that and you take precautions. The other thing, obviously, it's safe to come to Huntington Hospital. And if you're not feeling well and you need treatment, you need to go to your doctor. You need to go to the hospital, because as we heard, people are not doing that, and other things are manifesting, and people are getting sick and not being treated. And lastly, testing. The state of testing is much better. If there are symptoms and it's appropriate, please go get tested. You're going to get a result a lot more quickly, and that helps everyone overall and helps the fight. So I want to thank again. I want to acknowledge Dr. Nick Fitterman, who's the executive director of Huntington Hospital, Dr. Leo Huertas, who's the chairman of emergency medicine, Christine Zingali, who's the director of cardiology and critical care, Cecil Joy, respiratory therapist, for her perspectives, and Sandra Mora, environmental services specialist, for all of her wonderful perspectives. Thank you all, and we look forward to better days, but we thank you for everything you've done.
Thank you.